See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
What would make a place somewhere where you would want to work? What would you like your workday to look like?
How do you change the incentive structures in the leadership so that one of the things you brag about is the number of people who got better at their jobs because they worked with you, or the number of people who took on such a leadership role that they were promoted?
The U.S. turnover for nursing right now is at 23%. It's the highest it's ever been in the history of U.S. healthcare. So it's like, why? Why is that happening? By far, the number one reason why nurses are looking for a new role is they're looking for career advancement.
The nurses, they're young and they're smart and they're tech savvy. They need to have the opportunity to participate in the work and design their own future.
I think it's time to say, what are the lessons we learned about how our workplaces are not serving people, and start creating the kinds of workplace that we would have wanted to work in. That can actually be a fun challenge. And we can involve people that are not served by the current hierarchy in the design of that, because I bet they have a lot of good ideas.
Welcome to See You Now. I'm Shauna Butler. Anyone following the headlines or counting on our healthcare systems is well aware of the significant, urgent, and ongoing challenges facing healthcare. We're flooded daily with news about what's not working in healthcare. It's no secret, the worsening nursing vacancies, understaffing, and career exits have serious implications for care quality, workforce morale and safety, patient experience and access to care, and the financial stability of our healthcare systems. Striking a more hopeful and helpful tone, as we dive into 2023, See You Now is turning the spotlight on those taking action to learn what's needed, what is working and gaining traction, and particularly at this moment of significant social change and systemic levels of recalibrating how, why, and where we work, what leaders must do for their workforces to be energized and empowered, where the focus on thriving isn't just about recovering from the impact of the pandemic, but more importantly, coming out the other side doing even better. Over a series of 3 episodes centered on redesigning work, we're exploring our relationships with work. We're learning what nurses are saying, seeking, and what they need to thrive in their careers. And we're checking in with nursing executives and healthcare employers to hear how they are taking action and evolving. In our first of the Redesigning Work episodes, we poked at the broad questions in psychology of what people are seeking from their work and careers, and learned from psychologist and motivation researcher David Yeager what business cultures and mindsets truly support a person's natural desire to do impactful work. In the second segment of the series, we centered on the voice of nurses and learned from entrepreneur, problem solver, and CEO of Incredible Health, Iman Abuzaid, what nurses are experiencing and seeking in their work, lives, and careers, and how the team at Incredible Health is helping nurses find and do their best work. In our third and final installment of the Redesigning Work series, we zoomed in on the workplace to learn from nursing executives from around the U.S. about how they are listening, taking action, and evolving to empower nurses, advance their careers, and respond to the market demands and health needs of their communities. We start off by checking in with the nurse executive of the largest Catholic health system in the U.S. that employs 45,000 nurses in more than 1,000 care sites across 21 states. So let's dive in.
Hi, I'm Kathleen Sanford, and it's my privilege to be the Chief Nurse of CommonSpirit Health. And I say it's my privilege because I think it's a privilege to lead. I think it's a privilege to be able to work in this day and age to figure out how we are going to have what we need today and tomorrow to take care of our patients, to take care of each other, to take care of our communities, to take care of our companies, to take care of our country. We just had the focus groups of the nurses across the system, and it was over 200 nurses. You tell us what are the most important things to do next. And that's where we're going to put our time and energy. And across the system, all the different states, the top 4 things were these: shared governance, individual professional development, which excites me because I think that's something we need to do for everybody, whether they're a nurse or a housekeeper or a respiratory therapist. Academic partnerships. They were big on academic partnerships. And then 4th, not first, formal resilience and well-being programs. And as we move through all of the things that nurses would like to see, it will affect the next thing they want to see, and then the next thing they want to see, and we will develop, and that's what excites me. I understand that there are issues and there are problems, but I do think we have an opportunity to do something about it. The new grad turnover, even before COVID, was double the turnover, and that turnover is pretty high among nursing anyway. And so we looked at that and said, okay, this is terrible. And why are they leaving? And what was even more distressing is some of them, after having spent all that time in school, were leaving nursing. So we looked at issues and said, tell us what's the problem. And they just simply didn't feel prepared. When you've spent your time in school and you've had an instructor there to help you, that's a little bit different from what happens in reality on nursing units. And we found that many young students didn't feel welcomed by nurses. As long as we're going to talk about the truth, right, and speak about that, many of them felt even bullied by more experienced nurses and disrespected and not helped. So there were a variety of issues, and many of them didn't feel safe because of how patients have started treating nurses more and more than perhaps in the past. It's still a minority of patients, of course, but it's a growing issue. So those young students who came out, that's been their introduction to nursing, and they have just said no and walked away. So we decided to have a residency program that would be different from what most people do. Most people have programs that they call residency, but they're fairly short, and many of them are just extended orientation. So we looked at the literature and talked to educators to figure out what was the best thing to do, and came up with a program that lasts 12 months. Now, that frightens some of our productivity people who say, oh my goodness, we can't have them doing nothing for a year. And we're saying, we're not going to be doing nothing for a year. They will be taking care of patients, but they will be in a formal residency program where they are deliberately supported and helped and have what they need to adjust to the world of nursing. So it's a year-long program. 70% of that is actually taking care of patients. But the rest of the time, we have classes on knowing yourself, knowing how you work well with people, what to do if you feel like you're being abused, how to speak to patients who are being rude that is still kind and loving, where to go if you have a great idea and no one's listening to you about how to do better in healthcare, and just how to deal with all the problems that come when you work with people and when you work with people who are not bringing their best selves to the workplace. This needs to spread to other nurses. We decided to start with the new grads, and I've already had nurses that are 4 and 5 years in saying, well, what about us? We need this, and I agree. We're also going to have 24-hour virtual preceptors. So a new grad that has a question or is worried or concerned can just immediately contact with a virtual experienced nurse who will say, let's talk this through. Not tell you what to do, but let's talk this through. I think some of the experienced nurses will get a little coaching from the new ones because they will have had that extra help. We realized that in order to have a more diverse workforce, we needed to partner, and we need to partner with academia. We are working with a university in the Philippines. We're working with some universities, beginning to work with some universities in other countries. And we are working within the United States to become more diverse as well. And we want to make sure as we do this program that we are helping people understand that it makes your community healthier when you have more nurses. And it makes your community fiscally healthier when you have more people with jobs such as nursing that can increase the income level and the fiscal health of the community. So right now we have a partnership with Charles Drew University, which is in Los Angeles, which is a historically Black university, working together to figure out how we're going to not only attract more diverse individuals to nursing, but how we're going to help them get into the school, how we're going to help them get through school, how we're going to help them get into residency programs. We do this for everybody, but we have a special interest in people who may not have even thought about a healthcare career. And so we're partnering with Charles Drew to do more of that, both for staff nurses and also for advanced practitioners. Charles Drew has a wonderful advanced practice program as well. And we're working with them, not just with those who have already been accepted in school, but what we're going to do to start attracting younger people, junior high, high school, maybe even younger. We have a program where we help kids with their homework after school, and we talk to them about careers. And so we're going to grow that and make that even larger. We already have one program in LA where kids come to a center after school and get tutored, not only by nurses, but by other people who teach particular subjects and tutors. The nurses are more likely to go into the schools to talk about nursing as a career. See, I believe that you cannot be a healthy community if you're not fiscally healthy. As we are educating the children, we can also learn and talk more with the parents, because there are parents who might be willing to come back to school as well. We have a lot of second career or first career older people in nursing right now, and we can help make this a more diverse profession when we don't just concentrate on kids, but we concentrate on other people who'd like to change their careers. Healthcare jobs are pretty good. They're a way that people can help themselves, their families, and their communities. One of my favorite books is David Augsburger, Caring Enough to Confront. I spend a lot of time talking to my colleagues about confronting big and little things, because we're talking here about fairly big things, but there are a lot of little things that cause problems in organizations and between people and make them not be courageous enough to confront. And so how I call on people is I talk about that book a lot and say, if we care about this organization, if we care about what happens to our people, if we care about our patients, we will have the courage to confront the problems, and we will have the courage to say thank you to the others who do. So that's one of the things that I talk about all the time, is that as long as we are afraid to have these honest conversations, we're going to continue to have chronic problems. And in the end, the chronic problem is what's going to kill us. You cannot be innovative if you're not going to take risk. Innovation means you either come up with something totally brand new, or you improve on something we're doing now so that it's better for your patients, your employees, your hospital, your community, whoever it is you're trying to make things better for. And sometimes we simply don't have the courage to do that. Now, that is going to take not just nursing as a whole, that's going to take nursing leadership and other leadership that understands we should reward people for taking risks, for having the courage to try and do something else. And when they fail, we should thank them for having the courage to try.
Hi, I'm Maureen Sintich. I'm the System Chief Nurse Executive at Inova Health System in Northern Virginia. And I have the privilege to lead over 7,000 amazing nurses.
I'm Maggie Swietlik. I'm the Chief Nursing Informatics Officer at Inova Health System in Northern Virginia. And I'm grateful to have the opportunity to work with our informatics teams, IT, and the frontline staff.
Inova Health System is an integrated interprofessional health system that sits in Northern Virginia. We have 5 acute care hospitals, over 1,900 beds, fully integrated, the entire continuum of care, inpatient, outpatient services. And we have almost 20,000 team members with nearly 7,000 nurses practicing.
Every leader, every team member, every area within the facilities, you not only hear people speaking about the culture, but you see them living it. And it's really an impressive and inspiring place to work.
We were thinking about what we could do differently to provide better care. And we were listening to colleagues across the nation who were impacted earlier than we were in the pandemic, and listening to our team members because they had ideas on what we could do to make a difference. It wasn't just a top-down, thou shalt, this is what we need to do next, but it was a bottom-up. And every day, they were coming together, learning, growing, developing, and designing to provide better care. And we were also hearing from our nurses that they wanted to do more. They wanted to contribute more. And that led us down the path of some work that we had started pre-pandemic, where we were thinking about redesigning our nursing congress, our shared governance structures, because we really wanted to pull in and lean into the impact that nurses have every single day and their ideas on how to improve practice. Our workforce is amazing, and they are resilient. They want to make a difference. I will also say they are extraordinarily busy, and they no doubt are stressed.
They just feel overwhelmed. They feel stressed. They feel that they cannot do another thing because they've reached their maximum and they have reached their limits in terms of how much they can take on. So whatever that taking on is, whether it's physical work or documentation or even just another shift. So it's a feeling of being overwhelmed and being stressed.
And so it's up to us as leaders to provide them with the right support and infrastructure that they need so that they can be their best selves, not only in the workplace, but also when they go home. And so we spent a lot of time talking about what brings them joy, what brings them purpose. And those are conversations that happen at the department level with team members and frontline leaders, all the way to our CEO. This is a great example of primarily frontline nurses coming together with leadership and identifying what the priorities are for the nursing workforce, taking those priorities, converting them into goals, and making them actionable. So we held some focus groups, and a number of nurses participated, and these were all frontline direct care clinical nurses. And we used the IHI, Joy in Work methodology, talked about what gives them a great day, but really focused in on what gets in the way of having a great day. And they talked a lot about the amount of time that they spend in the record, the amount of time that they spend not having what they need at their fingertips. And where Maggie and her team and our technology team members stepped up and stepped in, it was to make sure that the equipment was there, that it was readily available. And they put processes in place today that are still ongoing. Taking that one step further, Maggie and her team developed a nursing informatics liaison program where we would identify those frontline nurses who are passionate about informatics and want to learn more, and their roles and how they can better support their colleagues.
What we wanted to do was offer an opportunity where there was some growth. And so with so much interest and so much technology, we stood up the Nursing Informatics Liaison Program. We did the math and came up with about 24 nurses spread across our facilities, and each of them could do 8 hours a month, and then we would figure it's just a little bit over 1 FTE worth of time. So what we did was we offer them a month of continuing education every month so that they get contact hours towards their licensing or certifications. They get an hour with their mentors, as well as kind of tips and tricks and the skills that go with nursing informatics. And then the rest of the time, the other 6 hours, is spent working in tandem with their mentors in our facilities, doing really hands-on nursing informatics work. So whether it's rolling out new technologies, supporting an upgrade, or even just going around coaching and promoting adoption of something as simple as a communication device, they are in the trenches with the rest of the staff nurses, and they are our best advocates because they are the peers to the people that they are supporting. It's a 1-year program, and it has been successful in many things. One, it's exposure. In addition to that, it became the feeder program. Now, we had no turnover in nursing informatics within the team for 3 years, and this summer we had 3 turnovers at one time. And so what we had was the immediate feeder program where we were able to hire from within, and we were able to grow. And since then, we've talked to our patient safety team, our pharmacy team, as well as other teams within the organization who are very interested in this same model and figuring out how do they start to build that program where they can offer these opportunities to their own team members and allow them some additional growth.
It's an awesome program. As we started to hear from team members who were leaving the organization, well, they're leaving for an alternative career opportunity. And so as part of the development of the Professional Development Sub-Council, they created a task force to rethink our clinical ladder. What we wanted to do was to offer a career development plan. It could be used within the professional ladder or separately, and it can be launched immediately following orientation. For example, we know that nurses may come into a med-surg unit, gain experience, but then they're thinking about, well, I might like to try the OR. Or peri-op, which is very different, or L&D. Or I might like to try community health or go into the ambulatory space. And so what we will have is a formal process to be able to launch that. And we're very excited about that because nurses can come into an organization, and we're large enough to be able to offer a multitude of different roles and experiences. What about advocacy and health policy? It's really an opportunity to shift our mindset and think about meeting people where they are, really getting to know them. And I think that that goes back to the culture that we have in understanding what people's desires are when they come into an organization and where they want to see their long-term growth. And so we're very excited about this. I believe that it will serve as a template for other groups of healthcare professionals, and I can't wait to see where it goes for the future. I think it's structure, process, outcomes. We have a structure in place from the executive team through our service lines to the bedside where nurses are actively engaged in the leadership of the work of the health system. And so whether it be within triad partnerships, a nurse, a physician, and an administrative partner working together, all the way to the unit level, and then back again through bidirectional communication, that information flows. And so to give you an example of what that might look like, nurses bringing forward their concerns about workplace violence. And they came forward and expressed their concerns around what was happening in the workplace, bringing their ideas on what they thought would make an impact. We have a zero tolerance policy, but how do we communicate that zero tolerance policy? They asked for patient-facing signage. They asked for additional security support. They asked for technology assistance. All of this information was brought back to our CEO. We are making and have made significant investments in their safety. The signage was created and posted in patient-facing areas with their recommendations. Our CEO wrote an op-ed. That's just the communication part. This is an area that is difficult to talk about, but it's very real and it's very raw for our nurses.
The nurses, they're young and they're smart and they're tech savvy. They need to have the opportunity to participate in the work and design their own future in terms of how they provide care. And so it's going to be tapping into the multitude of technologies that we can provide for them. But we need to know from the frontline staff exactly what it is that would make their work easier, and then providing them with the team members who are going to build them the ideal workplace in which they can provide excellent care.
We're moving from being very focused on what has been historical identities of different professional groups to more of a people-centered mindset in thinking about how we support our teams, because we want to be that place where you go, you start your career, and you can have a multitude of different experiences in our organization. Nurses go into quality. Nurses go into safety, into informatics, into technology, into innovation. Who better to facilitate care for the future than nurses who spend the majority of their time providing that care and understand where the pebbles and sometimes boulders in their shoes may lie?
I'm Kathy Howell. I'm the Chief Nursing Executive for UCHealth, and that's a large health system in Colorado. We have 12 hospitals and about 28,000 employees. My outlook as a healthcare leader, as a nursing leader for many years, has always been one of optimism and of being a builder. Part of my responsibility is to support over 9,300 nurses. In addition to that, many pharmacists and assistive roles that assist nursing as well. My days can vary from talking very strategically about developing a whole new program, or it can be very tactical. Do you know what happened last night at 3 a.m? And we need to have an immediate response to something. So I try to stay as strategic as possible, because you kind of have to jump in and be tactical and then jump right out and maintain the strategic focus. We have a whole series that we call Listening and Learning, where I go in to frontline leaders and frontline staff and just listen to them. And then we have another kind of a structured way we do this called Focus on the Frontline. And that's where we do a lot of rounding on weekends so that we are listening. And what we're hearing, it's been a challenging 3 years, as it has been for the whole world throughout the pandemic. And there's been a lot of moral injury. And when I say moral injury, it's like, what is that? Well, as healthcare professionals and healthcare clinicians, we're all in dealing with the human condition and people's challenges and life and death and drama. It's what we signed up for. But when I say moral injury through the pandemic, there was such a disbelief of the pandemic. We've seen patients die in front of us, denying they had the disease. We've seen colleagues question it. And then the other piece that's, as we've rolled out of things, the world is a bit shaky right now. And we in healthcare, you get people on the best and the worst days of their lives. So with all the stress in the world, it coalesces here in healthcare. So we've had to really, and this is probably what's been the most disheartening thing for our frontline, is patients and visitors are not happy and take it out on their caregivers. Every single hospital, every day. Our data shows we have actually a physical assault about 3.4 times a day. And that could be physical assault. It could be just a scratch, could be a pull, but it could be really harmful. And so we took our largest hospital and the 3 units, and that's about 140 beds of where we have the most violence and we have the most challenges. And we hired behavioral health specialists who just 24/7 round on patients at risk and with our staff to help develop therapeutic strategies. And those are strategies that really help benefit the individual who, it could be a behavioral health condition, it could just be other conditions that they have, and help the nursing staff develop better plans of care and strategies and really help that individual patient be much calmer and have more control. Because, many times they're acting out because they don't have any control. And this is the scariest time in their life. And we're spending so much time equipping our front line in how to protect themselves. That has been a game changer. It's cost us to do this, but it's been well worth it. It's a challenge we all have to work on together. And it's an unfortunate state of the human spirit, is what I call it. And we all need healing. We look at our turnover, and that's nurses leaving our workforce, and we are challenged. A couple things we're doing, back to the listening to our frontline staff, is what are the things in the workplace that we maybe can control and bring what we're calling the joy back to nursing. And that resonates with nurses. It's like, yeah, I signed up for this. I love taking care of patients. But when I have technology problems, like my computer's not working or the IV pump's not working or I don't have the equipment I need, that's what frustrates me and creates challenges. And that's where we as leaders, we've got to take these frustrations away. One way we've done that, because we've heard it loud and clear from our frontline nurses, is technology. While it's been great and it's part of this innovation in healthcare, but it breaks, it needs to be maintained. So we designed a brand new role called a patient technology technician. And these are individuals that are in our hospitals 24/7. So they're there every time nurses are there. And what their job is to ensure all the equipment is working. If something's not working, to get it fixed. They're able to help patients as well. If a patient has a piece of equipment on that isn't working, they can go to the bedside, touch patients, fix that equipment. And we did a pre and post survey of our nurses, and it was dramatic. There was a lot of nurses said, this is a game changer. Like, I can't work on a unit without this role. We are actually putting this role in all of our hospitals. We're hiring 140 patient technology technicians. And then on that cool side, a lot of people who kind of thought they liked healthcare, They like technology. We're able to hire a lot of individuals like that are able to just come in, try it on, and then really kind of helps them determine if they want a healthcare career or not. So that's a home run. And we've just got to have more home runs like this. And frankly, we haven't had home runs. And we in leadership positions have to own that and really make these gains. And innovation isn't just about technology. I see it's marrying technology with care processes to really improve the care environment so our clinicians, our nurses can do their job better every day. So we have a center called a virtual health center. It's not in our hospital. It's in a separate building. And it's everything virtual. And we do a lot of remote monitoring of patients and things. So what we did for our wound care nurses, and wound care nurses are really specialized nurses who really treat and help prevent wounds from occurring in a hospital. You never have enough of these nurses. And so how can we help them? So what we modeled, and it's really worked out, is putting a wound care nurse in our virtual health center. So it's like a virtual cockpit, kind of like the air traffic controller. And we have electronic medical records, and we've got lots of technology for visualizing remotely. And so these nurses are able to look at the whole universe of patients that are in our beds and say, these are the high-risk patients. And we use our data that's in that electronic medical record to help us risk stratify. So that just gives us the data to tell us who are the most high-risk patients. And they're able to then see those patients virtually and partner with the bedside nurse. We were able to see 38% more patients using this model, but we didn't have to increase our nursing staff. And actually, they loved it. So one day they can be in the virtual health center doing that prevention work. And the next day they're on the floor actually providing hands-on care. This project was done at our largest hospital, our academic medical center, which has 700 beds. So now we're talking about how do we scale this and make this work for the rest of the health system. So it's an example of how we're taking our nurses with expertise, giving them technology and processes so that we can make them more efficient and actually make their role better so that they really enjoy what they're doing. Part of our mojo, part of who we are is you come here because we want you to grow your career. So we've always been focused on career development for our nurses. We have what we call a credentialing program, and this is just one way they can remain clinical but be promoted and remain at the bedside or in the clinic. It's called UCHealth. We pay our nurses to take on a project to improve care. We help them and give them resources and help teach them how to do this. Their peers actually assess and review at the end of this year-long whole project and process. And then they're the ones who determine do they get to promote or not. And it's rigorous, but it gives them the ability to grow. What we have found from those credentialed nurses, they're our future leaders. So we're a large health system all over the state of Colorado. It's really been helpful in career progression. Because it's like, we have many nurses who maybe were living here in Denver. And it's like, I want to go live up in Steamboat, ski resort town. So when I'm rounding in my hospital in Steamboat, I'm always seeing nurses that were maybe living in Denver before. We just want to change a pace in our life. We have an example of a nurse who now is working in our virtual health center. She was involved at the unit level in many, many projects, caught the innovation bug, and there was an opening there for a leadership position, and she just started in that position. So we have a lot of career mobility within our health system that we really try to promote. And one of the most recent innovations that we are working on scaling now is what we call RN Job Share. And during one of our listening sessions with our frontline, we were talking about, what can bring the joy back to your job? And so we started talking about these nurses who've kind of cobbled together their jobs. It's like, a couple days a week I do this, and the other days of the week I do that. And we're calling this RN Job Share, where I was thinking of Match.com, the dating service. And this is like nursingmatch.com. So we've started a process where nurses and we have a site on our intranet where they can go in and say, gosh, I like what I'm doing, but I'd like to try something different. These are the kind of things I'd like to try. And so we have a team behind that made up of some nurse leaders and then our talent acquisition team to say, how can we piece this together so that I can work in these two care settings and it's a full-time job and I can get some change in my job. So we have nurses like that work neonatal intensive care and they work the emergency department. We have nurses who work inpatient oncology and then outpatient oncology. We're really trying to listen and piece together different roles for nurses so that their career can continue to grow and bring that joy back. That's just a couple examples of what we're doing. What we need to shift out of is kind of that old hierarchical structure. It's like, oh, you need this much experience before you go into this job and this much experience before you go into this job. And those are hard to change. And so really listening and listening to our frontline staff, and especially we have a very young workforce here, which is actually quite a gift. But their thinking is different. For instance, when we have our new nurses coming on, and we have about 600 new nurses a year, meaning new graduate nurses. And when you listen to them, it's like, okay, I'm coming to you. I want to get this great experience. Then I want to go travel for a while with my girlfriends or my boyfriends, etc. Then I want to come back. And then I want to do this. And then I want to do that. And then we're going, oh my goodness, that's a lot to track and trend. But that's our world. Our biggest is looking internally at all of us and our leadership teams to say, we have to be okay with that. We have to be flexible and really have to meet the nurses where they're at. We're making progress, but we're not 100% there yet because it's a lot more work. As a manager and a leader, it's a heck of a lot more work. But it is where we're at, and we have to meet our world where it's at and then adapt and adjust.
Special thanks to nursing executives around the world, and especially to our episode guests, Kathleen Sanford, Maureen Sintich, Maggie Swietlik, and Kathy Howell. Nursing executives are listening, soliciting input, learning from their team members at every level and location of their organizations, and they're taking action to stem the loss of talented, highly skilled nurses, as well as ensure they're building cultures and careers that attract and inspire the current and incoming generations of healthcare professionals. As Iman and David shared, there are some really amazing leaders across the country. Scattered among them, there are several nursing leaders. They're coming from HR, from CEOs, CNOs. They're really trying to move the ball forward. And those that have really acknowledged what the problems are, that this isn't just about pay. It's about a desire for safe places to do their best work, live their best lives, advance in their careers, have careers that match their lives so they can bring their best selves to caring for the people and families in their communities. And those executives that really understand the problems and are implementing programs, developing roles, creating and cultivating mindsets and cultures to address the workforce challenges and changes are seeing the results, and they're seeing them now. If you've not yet listened to our first two episodes in our Redesigning Work series, do yourself a solid and check out episode 83 with psychologist and motivation researcher David Yeager, and episode 84 with co-founder and CEO of Incredible Health, Iman Abuzaid. For See You Now, I'm Shauna Butler. Thanks for listening. And especially to our nursing executives, thank you for listening and taking action.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation, Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.